Hello. Good morning, good afternoon, good evening, depending on where you are in the world. I am Dr. Steffany Moonaz. I'm a yoga researcher at the Maryland University of Integrative Health, which offers a master's of science in yoga therapy. I'm also a practicing yoga therapist and founder and director of Yoga for Arthritis. The focus of both my clinical work and my scholarly work is on the effects of yoga for people who are living with arthritis and rheumatic conditions, many of which are autoimmune in nature. And that brings us to today's topic. And I'm going to pull up my slides for today's presentation on yoga for managing stress and flares in autoimmune disease. I brought this topic to the HealthFlix lineup just because during the current pandemic, there are unique considerations for people who are living with autoimmune conditions, and yoga can be particularly useful at a time like this. It has a role to play in the management of autoimmune conditions in general, but times like this when autoimmune diseases can be even more challenging to manage and external circumstances can be even more challenging to manage for those with autoimmune diseases, I thought it was an important topic to discuss. So, as an overview, what I'm going to cover today includes what the unique risks and challenges of living with an autoimmune condition now during this pandemic are, how stress plays a role in autoimmune diseases in general, and right now in particular, and then the relevance of yoga practices for fostering well-being amidst those challenges, and then ways to make sure that people who are living with autoimmune conditions are practicing yoga safely and supported. And then I'll guide you through a brief experiential practice. So autoimmune diseases are becoming increasingly prevalent. I'll first say that there are over 100 autoimmune conditions. Just in the category of arthritis alone, there are over 100 conditions. Expand that to all autoimmune diseases, and it's many more. And those conditions are chronic. Many of them have no cure and imperfect treatments. They can lead to disability, and in some cases, they can even be life-threatening. And they impact about 5 to 10% of the population in the developed world. As an example, here where I am in the United States, 1 in 12 adults have an autoimmune condition. It's 1 in 9 in women, so it's more prevalent in women. And that is a huge increase from just 30 years ago when it was 1 in 400. I'm not going to get into the many reasons why that increase is happening, but I think it's important to note that it's becoming more prevalent and including more of the population. So if you don't already know someone who has an autoimmune condition, you probably will. Now, what autoimmune conditions share is that the immune system is dysregulated so that it recognizes the body, some aspect of the body, as foreign. So the way that our immune system is intended to function when there is a foreign invader, a threat like a virus, then our immune system mounts a response in order to get rid of the threat. Unfortunately, in autoimmune conditions, the body is perceiving itself as the threat. And the tissues that suffer are the tissues that get identified as foreign. So in rheumatoid arthritis, for example, which I do a lot of work with, it's the connective tissue in the joint that's identified as foreign, and therefore the immune system attacks that connective tissue and degrades it. Whereas in other conditions, it may be the pancreas, it may be the skin that is identified as the foreign tissue. And when someone has one autoimmune condition, they are prone to have others. Their risk of having other autoimmune conditions is increased. So in that case, it's possible to have multiple organs and body systems involved in that autoimmune process. Here are just a few examples of autoimmune conditions you may recognize. Rheumatoid arthritis, as I mentioned, lupus, multiple sclerosis, psoriasis, Hashimoto's thyroiditis, type 1 diabetes, ulcerative colitis, and Crohn's disease. But again, there are over 100 of them, so that just scratches the surface in terms of what conditions are included in this category. So what's a disease flare? And any of you who are living with autoimmune conditions are very familiar with this concept. Autoimmune diseases tend to have peaks and valleys in their disease activity. So a disease flare, some people call it a flare-up, is a period in time when the symptoms are heightened. And that is when the immune system has mounted a heightened response. And if you have ever had a pathogen like a bacterial infection or a virus, you may be familiar with some of these symptoms. Imagine if you've ever had the flu, the worst flu that you've ever had, where you feel exhausted and achy and swollen. It's hard to concentrate. And in addition to that, these flares may include symptoms like numbness and tingling in the hands and feet as circulation is compromised, even hair loss and skin rashes. And so you can imagine, in addition to all of this, the potential for also feeling pain. And for those with autoimmune conditions in their joints, the joint pain is one of the primary features. So then there certainly is an impact to being able to function physically, but also being able to function psychologically. That then impacts sleep. Both the physical discomfort can impact sleep, the psychological challenges of it, the emotions associated with it can impact sleep, and then sleep then exacerbates the experience of the flares. There can be a challenge to what we call activities of daily living, just your ability to go through your day and handle the tasks that are a routine part of your day. There can be an impact on professional work, on social roles, and on caretaking. So especially right now, many of us are caretaking in ways that we weren't before. We may be homeschooling our children in addition to working at home full time. We may be caring for parents who are higher risk and are less comfortable leaving the house, or who are unable to get their usual caretaking from other sources. So if you're in a disease flare, your ability to perform all sorts of roles can be challenged. And right now during this pandemic, more may be asked of everyone, including those with these conditions. Now, disease flares are often addressed by using what may be called a rescue drug. So there are the medications that someone might take regularly in order to dampen the immune overreactivity, to sort of calm the immune system so that it doesn't overreact. But then even despite those medications, it's possible to have a disease flare, and then there might be another drug that is added to the regimen in order to quickly respond to that flare. And there may also be an increase in dose of a routine medication in order to get that flare under control. Now, what happens when someone is taking medication to dampen immune function is that there is also the risk of infection. So because the medication is telling the immune system to calm down, the immune system calms down universally across the board. So there are not ways to tell the immune system, okay, just don't attack the pancreas, but still bring your full force to this viral infection. We don't have that kind of nuanced medical management. And so the immune system is dampened altogether, and that increases the risk of a pathogen coming in, but also of the severity of a disease where a pathogen comes in, because the immune system kind of has one hand tied behind its back, so to speak. When someone has an autoimmune condition and they need a surgery, for example, or a dental procedure where there is a greater risk of infection, oftentimes they'll have to go off of their medication for a period of time in order to have that procedure. So that just speaks to what the risk of infection really is when you're taking these medications long term. And so you can imagine what that means for this pandemic of COVID-19, for people whose immune systems are medically controlled. They are at increased risk of infection by the coronavirus, just as they would be at increased risk of infection for the common cold, for example. In fact, another relationship between infection and autoimmune conditions is that an infection can sometimes serve as a trigger for the disease itself. So when people look back on when they were diagnosed with an autoimmune condition, there is often some sort of a major challenge to the body that happens before the diagnosis, before the first onset of symptoms. And that is sometimes an infection. It may be an infection, it may be an illness, it may be a major life stressor, a major change, anything that that causes the stress response to mount, or the immune system to mount a response, which may then trigger an overreactivity. I like to explain it as sort of a switch. So for many of these conditions, there's a genetic predisposition, and that genetic predisposition can be flicked on by some sort of major life event, including an infection. And just as an infection can trigger the onset of the disease in the first place, it can also trigger a flare. So not only does the management of the condition increase risk of infection, but then any sort of infection can also increase disease symptoms. This is further complicated by the fact that many infections share symptoms with the autoimmune conditions themselves. So we talked about body achiness, fatigue. There's often a low-grade fever associated with it. So in some cases, it can be difficult to parse out whether this is a disease flare of the condition or whether this is actually some sort of an infection. All right, so then what does that mean in this current pandemic? And I've touched on some of this a little bit already, but in some parts of the world, it can be more challenging to access routine medical care. There are entire hospitals that have been designated as COVID-19 only hospitals. There are doctors who have been taken off of their usual roles and responsibilities and shifted into hospital work for this pandemic. And so being able to access your regular doctor, who also, even if practicing, may have reduced hours, may not have walk-in appointments, et cetera. So it can be more difficult to get routine medical management. It can also be difficult to access medications as needed. And that could be routine medications, but certainly especially the rescue drugs that we were talking about because of so many challenges to medical systems around the world. People with autoimmune conditions may also be taking extra precautions because they are at greater risk of infection. And that may mean being especially strict with social distancing. It may be difficult to access masks. And, you know, around the world, not everyone is taking this as seriously as everyone else. And so if you are a person living with an autoimmune condition and you need to leave your home for some reason, and for you, it's very important to maintain social distance, but the people that you're encountering don't necessarily have that urgency about it, it can be quite challenging. I was walking down the sidewalk the other day, and there were people having a conversation, and they were 6 feet apart. And the only way for me to pass was to walk in between them, which meant reducing everybody's social distancing. And so there can be very real challenges to things like trying to acquire groceries and that sort of thing. Even going to the doctor's office can pose a risk. But additionally, there is the aspect of social isolation, which is challenging for all of us, but especially if you are feeling the need to be even more socially distant and therefore not, for example, go outside for a walk where there may be other people that you might encounter. And the social isolation has its own challenges, both psychologically and physiologically. Additionally, while all of us are dealing with stressors that we weren't before, for those who have autoimmune conditions, they are also experiencing the challenges of potentially having lost a job, having to be in caretaker roles, the uncertainty of how long this is going to last and what it's going to mean, but then the health risk on top of that, to maybe a greater degree than other populations might feel. As I mentioned before, there may be changes in support structure. If there were other people who were providing care or assistance or resources, that may not be the case right now. I mentioned the overlapping symptoms, and then also just the things that people do to normally take care of themselves. I'm sure no matter who you are, you're feeling this. If you were in a routine of going to the gym to exercise every morning, you know, that has been disrupted. If you're now homeschooling children, probably your whole daily schedule has been changed, and that may be even more poignant for people living with autoimmune conditions. So stress. An important part of this whole equation is that stress and autoimmune function are inextricably linked for everyone, but especially for those with autoimmune conditions, stress plays a role in disease activity. When someone has a stress disorder, they are actually at increased risk of having a diagnosis of an autoimmune condition in the first place. Stress management strategies can actually reduce that risk. So if you're able to manage your stress well in the first place, you may be able to delay the onset of an autoimmune condition. But stress is also implicated in disease flares for people who already have an autoimmune condition. Stress management strategies can be brought to bear there too, because they can reduce the impact of stress on flares. So they may be able to reduce the severity of the flare or the duration of the flare, how long it lasts. Healthy behaviors are protective against those increases in disease activity. As we mentioned, healthy behaviors may be even more challenging right now. And we talked about how stress can impact sleep, which affects inflammation and immune function. Stress may also be more difficult to manage in challenging situations like the one that we're all in right now. All right, so I put this in because I think it's super important to consider the role of shame and blame. When I talk about how stress increases risk of autoimmune conditions and of disease flares, then sometimes people go to a place where they are blaming themselves for not managing their stress well enough, or blaming others for any role that someone else may have played in your stressful experience. It is not helpful, and it is not yogic to look backward and assign shame and blame, it's useful to take that information and think about what can be done going forward in order to better manage stress and set the conditions for improved health and well-being. So how does yoga come in? The nervous system has a component called the autonomic nervous system, which has two settings, sympathetic and parasympathetic. Sympathetic is our stress response, fight or flight, that many are familiar with. You know some of the features of the stress response: dilated pupils, increased heart rate, changed circulation, sweating, that sort of thing. The parasympathetic nervous system is the flip side of that switch, which is called rest and digest, which is when or oftentimes the relaxation response, when all of those systems calm down. And so while stress can activate the sympathetic nervous system, yoga practices can activate the parasympathetic nervous system, and you can't have both of them on at the same time, like a switch. Now, how do we affect the autonomic nervous system so that we don't spend a lot of time in the stress response, but we have a healthy response to stress and then a recovery from that response? One is exercise, especially cardiovascular exercise that gets the heart rate up. And that can be a feature of the yoga practice if it's done as a fluid moving sequence that gets the heart pumping. Mindfulness practice can influence the regulation of the nervous system. Deep breathing, especially extending the exhale, because as you exhale, you engage the parasympathetic nervous system. Relaxation practices, meditation, which actually changes the structure and function of the brain in areas associated with how we respond to experiences in our life and the emotions that we attribute to them. And then cognitive reframing, which is basically looking at something from a different perspective and finding a useful or more positive way of thinking about it. And yoga philosophy is a useful tool there. Now, for those practicing a physical practice of yoga, the yoga postures or sequences, if you're living with an autoimmune condition, it's important to ask your doctor about any contraindications or cautions, things that you need to be careful about, because you're probably not going to a class these days in a room with a teacher who can give you that sort of guidance. You may, however, with some recommendations from your doctor, be able to find some online resources that may allow you to practice at home. And those could include recordings or DVDs that you can use and repeat regularly. But also lots of yoga teachers are offering online live classes. In some cases, they may even be able to see you and respond to you and give you feedback, which is really useful. I would also suggest considering a one-on-one session with a yoga therapist who often can do this online and can give you individualized guidance and help you find a practice that's safe and appropriate for you, given your unique condition and concerns, and create a practice that you can use at home on a regular basis. It's important to consider safety first. Ahimsa is a Sanskrit word that means non-harming, and it's a central tenet to all of yoga practice, that whatever we do, we want to not harm ourselves and not harm anyone else. And that certainly, of course, applies to your yoga practice, that if you're practicing yoga, you want to make sure that that yoga practice is not harming you. In fact, I would say that if it's harming you, it's not yoga. In order to do that, you really have to pay attention to what's going on in your body, breath, and mind as you practice, how you feel, and then adjust, respond. If something is uncomfortable, make an adjustment. This is not a practice that you want to push through discomfort in, especially if you're living with a condition that could be exacerbated by that practice. If you don't have a home practice established already, I would start very gently and cautiously. Start with a practice that is really accessible, and then see how that feels before you make it a little bit more challenging and feel that out a little bit. So take it stepwise and give yourself time, because sometimes you don't feel the effects until the following day. You may not have access to a yoga studio with lots of props, but there are items at home that you can use to support your practice. You can do yoga practices lying in bed, sitting on the edge of a bed, in a chair, propped up with pillows, folded blankets, using books instead of blocks or neckties instead of straps. So you can be creative with items that you have around the house in order to adjust and modify. And a yoga teacher or a yoga therapist can give you guidance on how to use those tools in order to modify the practice for your unique body. You can practice together or with a loved one. So if you're in a household that you're sharing with other people, practicing together can be encouraging and supportive. But if you're not in a household with somebody that you could practice with, you may be able to practice online in a setting like this with someone you love. And there are also lots of online communities that are very active right now because many of us are at home. So you may be able to tap into an online community of people who are living with your condition, who are already practicing yoga and may have ideas or tools or recommendations to share. Oftentimes people think about a yoga practice as being something that you roll out a mat and you get on that mat and you do it for an hour or more. And I'm a big proponent of what are sometimes called yoga snacks. So instead of sitting down for a yoga meal, you might think about little practices of yoga that are sprinkled throughout the day. That may be more accessible physically because it's not as much challenge for the body at once as an hour-long physical practice might be. It also can be more accessible in terms of just the lives that we're living right now, where your routine may be different from how it normally is. And it also, I think, is sustaining to have these little reminders, these little boosters of yoga throughout the day. So here are some examples. When you're standing and doing the dishes or preparing food, you might think about, how does my alignment feel? Where is my body in space? Am I standing up tall? Am I noticing my posture, or am I slouching? Am I hunched over, folded forward, leaning to one side, etc.? Consider taking a mindful walk outside or in your own home. If you're going outside, you can use a mask and or social distancing. When I say a mindful walk, pay attention to the way that the wind is blowing. Pay attention to the temperature in the air, how much sun there is or isn't, the shadows of the buildings, any elements of nature, trees or birds or whatever nature there may be where you live. The idea of a mindful walk is to really stay in the present moment, to be in your experience rather than getting caught up in story about what has happened or what will happen, but just really appreciating the moment as it unfolds. Whatever you're doing throughout your day, stop and take a few deep breaths. We talked about that relaxation response. Taking a few deep breaths can turn on that relaxation response, especially if you're feeling stressed or overwhelmed. Consider a seated stretch break. A couple of days ago, I recorded a program on stiffness that had a nice long practice that gets all of the joints of the body moving. So you may consider checking that out, or another little stretch break that you might try. Do some movement in your bed before getting out of bed. We have that natural impulse to stretch in the morning before we get up. Allow yourself to indulge in that as part of your yoga practice. Consider a daily gratitude practice. So I have a practice where at sunup and sundown every day, I think of 3 things that I'm grateful for in that moment. Some people keep a journal where they write down what they're grateful for, which can help with that cognitive reframing, that thinking about what is positive in our lives right now, even amidst this challenging time. Consider looking out a window to find something lovely outside, just to change your perspective. It's also good for the eyes to adjust to looking at the distance when many of us are looking in close quarters for long periods of time. Perhaps journal and keep track of how you're feeling. This may be something that we all look back on and think about what our experience was as an opportunity for growth. set a timer and meditate for just 5 minutes, which if you continue to do that, it will gradually start to shift things in the brain. And then consider a progressive relaxation before bed, which can help the whole body to relax and may make it easier to fall asleep. Okay, so that being said, I'm going to guide you through just a very short practice, and then we'll move into a period of questions for anyone who has them. So wherever you are, I want you to bring yourself into a seated position. So you can see in this diagram that she's sitting forward in her chair so that she's not leaning back into it, but she's supporting her own spine. She has a pillow under her seat, which you can use in order to sit forward a little bit and feel that you're on the front of those sitting bones. You can rock side to side on your seat in order to find that position. If your feet are on the floor, plant them firmly in the floor. You might lift the toes and spread them wide and then plant them into the floor and feel your connection to the floor. Align the knees over the ankles. So adjust your feet so that your knees are right over the ankles, and align the hips with the knees. And then notice the spine. Feel the length in the spine. Imagine that there's a string on the crown of the head that's holding you up and lengthening the spine, creating space between all the vertebrae. Roll the shoulders back and down and let the arms relax in your lap wherever feels comfortable. You can close your eyes if you feel comfortable doing that. And notice the jaw. If it's held, allow it to relax. Notice the eyes if you're holding any tension there. And just scan the body for a moment. Notice any parts of the body where you're feeling tense or tight. And with the mind, allow those parts of the body to soften. See if you can let go of any muscle tension or holding that isn't necessary to keep you in this position. So you're using the minimal muscular effort just to stay where you are and letting go of everything else. Soften the toes, the feet, and the ankles. Let the feet just melt into the floor. Relax the shins and calves, the knees and thighs, so the legs are relaxed and supported by the chair or wherever you're sitting. Feel the pelvis sink into the chair. Soften the abdomen, let go of any tension or holding in the belly. Feel the ribs expand. Relax the chest, the low back, the mid back, the upper back. Relax all around the shoulders. The whole torso is relaxed. Soften the fingers, the palms, backs of the hands, forearms, elbows, and upper arms. The arms are fully relaxed, fully supported. Soften the neck and throat. Relax all the muscles of the face and around the skull. And now notice the breath. Allow the breath to be easy and full. Lengthen the exhale, so slow that exhale and feel how that allows the body to relax even more. Deep breaths in and slow breaths out. Imagine that as you breathe out, you're letting go of even more stress and tension, letting go of any concern. And then notice the mind. Again, let go of any unnecessary thoughts. Just allow yourself to be here in this moment right now, experiencing this practice. Allow the mind to be open and clear and free. And we'll spend a moment here in silence, just enjoying this relaxed body, easy breath, clear mind. Take another deep breath in and let it out with a sigh. Move any parts of the body that feel like they need movement. Stretch, reach, twist, whatever feels good to you. I'm going to stop my share here and come into the Q&A. So I don't see any questions here as of yet, but if you have any questions, please feel free to type them into the chat and I'm happy to answer them. I'll also say that there are some references. Actually, let me just go back to those slides for a brief moment here so that I can share with you. Of course, so this is my contact information. So if you have questions and you can't think of them right now, so feel free to type them into the Q&A. But if you can't think of them right now, these are the ways to contact me. My website is arthritis.yoga and my email is info@arthritis.yoga, and I'm happy to answer questions that you may have on the other side of this. And then, of course, here are the references that I used for this session that that may be helpful to you. And I see that there's some activity in the Q&A, so I'm going to stop this share now and head over there. Okay, so Danya asks, how do you distinguish between mindfulness and traditional yoga practice? So good question, Danya. I would say that yoga is a mindfulness practice. So a mindfulness practice is any activity in which you are being mindful, which means that you are bringing yourself fully into that experience without distraction of what has already happened, what might happen, what fears, concerns, worries you may have going on in your head during the normal day that we often don't pay attention to. So if you are talking about the physical practice of yoga, which may be postures, yoga postures, asana, those are one way to be mindful, because when you're engaging in the physical practice of yoga, you should be paying attention only to the physical practice of yoga, how everything in your body feels in those postures, how you're breathing, that you're focused, where you're focused, how you're focused, being fully embodied in that practice. But yoga pranayama, the breathing practices of yoga, should also be a mindfulness practice, because during your breathing practices, you should be fully attentive to the breath without distraction of what's going on outside or what your children may be doing. But yoga is just one way to be mindful. You can also be mindful while doing the dishes. If you are fully attentive to the experience of doing the dishes without distraction, you're noticing the warm water on your hands and the suds and how your hand is moving around the plate and how the water rolls off of the plate as you wash it, and how the cloth feels as you dry and how you set it down on the rack. So it's possible to bring mindfulness to absolutely any activity. So when I was talking about a mindful walk, you can take a walk outside and intentionally make that a mindfulness practice. And you might say that when you bring mindfulness to any experience, that experience is a yoga practice. So your yoga practice should be a mindfulness practice, and a mindfulness practice might be considered yoga by nature of it being mindful. Danya says lots of long-term follow-up studies suggest that quality of life reduces to baseline. What she means by baseline is what the quality of life was before the mindfulness-based intervention took place. What do you think is happening here, and can you make the effect of mindfulness more sustained? So what often happens in those studies is that people stop practicing, right? So they get this, let's say it's an 8-week intervention, and they learn how to do this practice, and they do it for 8 weeks, and then the study ends and they stop doing it. So if you want to sustain the effects of the practice, you have to continue the practice. So think about exercise. There's no doubt that exercise is good for people. It's good for your physical body. It's good for depressive symptoms. It's good for quality of life. It's good for physical function, right? But the benefits of exercise are only sustained as long as you continue exercising. As soon as you stop going to the gym, all of that stuff falls away, right? So what's important, and this is why I bring in the suggestion of the yoga snacks, is that you find practices that aren't a practice anymore. They are just life, that life becomes a yoga practice, that you get up in the morning with a positive attitude because that's who you are, that you stand with healthy posture when you're brushing your teeth because that's just how you stand. You're breathing fully and deeply all of the time because that's just how you breathe. So when you make it the way that you live, as opposed to, I'm going to take an hour and get on my mat, that may be sustainable for a time, but then something happens and life gets upended and that routine falls away, and then you've lost the benefits of your practice. So how do we become the practice so that we're benefiting from the experiences of yoga, even if we're in a situation where that hour of time on the mat is not happening for whatever reason? So hopefully, Danya, that's helpful. Joanna is saying thank you. This, just for everyone to be aware, this will be posted as a recording. So if you wanted to go back and watch it again, you'll be able to do that. You can share it with anyone you know who may benefit, friends and loved ones who may find this information useful. Okay. So if there aren't any other questions, we'll close. I'll just close by sharing the sentiment that, you know, this is a challenging time for everyone in the world. I think it's causing us all to shift and adjust and adapt and accommodate and reflect and revise and consider. And some of that is really tough, and some of it is very tragic. And also some of it is beautiful, and some of it is an opportunity. And when we have tools that we can use, that we can bring to bear in that process, those can help support us in being able to find and use what is best of this time in order to manage what is most challenging about this time. So I wish you all absolute health and happiness and well-being for you, for those you love, and for all of us at this time. Thank you very much. Namaste.